Welcome to Positive Talk with Kevin McDonald. Hey, that's me. Hi, and welcome to Positive Talk. Our show features the best positive stories and people from around the globe as we endeavor to answer the universal question of why am I here and what is my purpose? Understanding that can change everything, and knowing your greatness is fundamental to living your best life. So join us right now as together we work to create the adventure of our lifetime. And welcome to the show, everybody. I'm so happy that you're here.
Me too. Aren't you just thrilled to talk about what would I call it? I would say that there is a whole category around health and this new fad with being hugely into the market of looking beautiful and doing this and doing that, and in so many ways that we didn't learn about how to take care of ourselves when instead of doing it later on with the plastic surgery, you can do it on sooner. Don't you think?
Yeah, that would have been very nice, Ed.
Yeah.
But things like our guest today, Heather the Hygienist, and let's bring her on right now. And Heather, it's a pleasure to have you here because I used to go to the dentist, and I would go, and they would say, "My, you've had a lot of work done. I've spent thousands upon thousands on my teeth." And it would have been nice because my kids grew up in a time when dental health was a bigger deal. And in the 60s, it just wasn't that way. So I'm glad you're doing what you're doing, and you're helping people of Rochelle's age because she's got a beautiful smile, don't you think?
Absolutely.
Now, this is your cue to smile, by the way.
And that goes a long way though, Kevin, because I didn't grow up like that. My teeth were super, super messed up. And Heather, maybe you know more about this, but they kept telling my mom that my teeth would adjust. They would fix themselves. They didn't. They didn't fix themselves, so I got braces late, which caused me to have other surgeries and things done. And then I had braces for about 5 years, and yes, now. But to get to this point, even though I'm young, it was lots and lots of years of pain and confusion. So,
Right. Well, honestly, 100 million Americans don't go to the dentist every year, nor do they even brush their teeth twice a day. So we have a major problem in America. And the number one killer of Americans is actually cardiovascular disease. So there's no fence in your body, right? Whatever you stick in your mouth is going to get into your bloodstream. And that bacteria that causes gum disease, that causes cavities, that gets into your heart and into your other organs. So I think there is this misconception that your teeth are like in a separate compartment, and people will say, "Oh, just pull on my teeth and give me dentures," But we can amputate teeth. We can make prosthetics, but like a prosthetic limb, it's never the same, and your lifespan actually decreases by 10 years. So I'm very passionate about just educating people. I've written books on how to be their own advocate, teaching people what good dentistry looks like, what bad dentistry looks like, the signs and symptoms of disease. And I have an oral care line. I just want people to start thinking differently about their health because, like I said, true health really starts right here.
Well, you're supposed to, like brush your teeth twice a day?
100 million Americans don't.
100,000,001.
Yeah. And, and people think, well, I brush my teeth, say twice a day. I'm fine. But you will lose your teeth from gum disease if you're not flossing. If you're somebody that is more prone to getting disease of the bone, which is called periodontal disease, the signs and symptoms are bleeding. But people will tell me all the time, because I've been doing this for 30 years, "Oh, my gums have always bled." Well, that might be common, but that isn't normal. Your gums should not be bleeding. If you washed your hands and your cuticles started to bleed, there's the problem. So I think it's just a matter of really educating people about, what is normal, what isn't, and the things that they can do to prevent disease.
And the one thing that I learned in my own particular case, because I've had root canals and I've had caps put on the root canals and all that kind of stuff. And you know what I learned fairly recently was if you have a root canal and all of the infection that is in the deepest, darkest reaches of your tooth root, if all of that isn't gone, that
Mhm.
can create a infection that doesn't necessarily come to the surface, but it
Yep.
can infect your entire body. Is that true?
It's 100% true. And honestly, doing a root canal, it's the only procedure in medicine today where we leave something dead in the body. I mean, if a woman gave birth and didn't get rid of the placenta, she could die, right? So it's literally leaving something dead inside of your body, and you're only able to access the main canals of the tooth. But there's over 75 microtubules that are attaching your root into your bone that cannot be accessed. So they have, when they remove the nerve and the blood supply of the tooth, and then they pack it with like it's called gutta percha, and then seal it. You're sealing in the endotoxins. 100% of root canal teeth have endotoxins left behind, and that's because it's impossible to remove all of that bacteria. And when they're actually doing a root canal, they clean it out with bleach. So they flush some bleach in there, seal it up with gutta percha, and if it lasts you 8 years, they consider that successful. But like I said, I've been doing this for 30 years. So many times those root canal teeth fail. And that's because your body just is not meant to have something dead. And if you didn't have a crown on that root canal tooth, it'd be black because it's dead. So that's why they put a crown on it, because it's a dead tooth. It's brittle. It has no blood supply. And, at what cost to our health should we have a tooth? And that's why I've written books to teach people, look, you don't have to have a root canal. You have options, you have alternatives. And I just want to teach people that, you don't have to get a root canal. So hopefully people will become more educated and make better choices for their health, because it really can seriously affect someone.
And root canals, by the way, speaking from personal experience, they're not fun to go through and to have. But I didn't realize, he never told me that there were micro nerves and stuff that are connected to the main nerve, because most of them they and Rochelle, have you ever had a root canal?
No, I think though the worst surgery I did have is when I had already had braces for a while, and I got all four of my wisdom teeth out, and then my canines, they pulled one of them that was in the way and cut out the gums around them, attached a bracket, and so I had a new bracket that went up that way and a chain that was slowly pulling them both down. It was pretty harsh, and I mean it was quite the experience to go through, but I don't think many people have all that procedure done at one time, and it affected my mood. It affected the way I ate. It affected the way I showed up in school, and I don't think many people really cared. After a few days, they were like, "Okay, no, you're good now," and it was just months and months of my head being in pain, and that doesn't make anybody feel good.
Mm-hmm. No,
And
absolutely.
and when you have a root canal, just so you know, what they do is they open up, they drill your tooth, and they open up the
Mhm.
the canal where your root is, and then they
Right.
take this it looks like a little bit of a sandpaper thing, and then they
Mhm.
jam it down into your root to pull out the root that goes all the way down. And what I found was, if my dentist wasn't really, really good at getting all the root, there would be a root that was left. And Heather, tell me if this is kind of common. There was a root that was left at the very base of it, and they might not have even been able to see it. But over time, because then they fill it in and they put the crown over the top and all that, and it looks all pretty and stuff. But over time, that that becomes, you get an infection in there, and then
Yeah.
it gets a little inflamed and all that kind of stuff. And so they really aren't doing anything to help you, are they?
Well, did you go to a general dentist to have that done, or an endodontist?
I went I went to my dentist, but one time he said, I can't do this. And so I went to one of those guys and he said, you know what? We can't do it either. So, it was my teeth were horrible when I was young, when I was growing up and stuff. But so I'm glad that you're here to help people who can get through and understand your teeth and how they and how it all works, because have you ever been eating something that you've probably never experienced this? Have you ever been eating something and suddenly you bite into something that's really hard and then you look at it and it's your tooth?
Not personally. I've actually never had a cavity, but I am somebody that builds tartar like nobody's business. So I feel like I grow fur on my teeth every couple weeks. So I'm somebody that would have gum disease if I wasn't on top of it. Because everyone has an oral microbiome of over 800 different bacteria, both good and bad. And like I was saying, some people are more cavity prone, other people are more gum disease prone. But we tend to wait till we feel pain before we go to the dentist, because most people don't like going. But the problem with that is you'll never feel a cavity when it's in the enamel, because your enamel has no feeling. You'll never know that you have gum disease until your teeth basically are ready to fall out. The signs and symptoms are there. Bleeding, sometimes a bad taste or odor in your mouth, loose teeth. Those are all signs of gum disease. But we tend to just kind of say, oh, that's normal. That's always happened to me, and really not take that seriously. I mean, people go to the gym. They're concerned about eating clean, but so many times when you ask them, when was your last dental cleaning or what products they're using, they don't go. They're using horrible commercial products. They're actually making their mouth worse. So I just think, like I said, there's this big chasm between, medical and dental, whereas they really need to be bridged. You need to have doctors asking their patients, hey, when was the last time you had your teeth cleaned? Because so many times it starts right here. I mean, your teeth are actually, they're organs themselves, and they're linked to other organs in your body. So we need to really start looking in the mouth to see if, that's the source of the problem, instead of trying to piecemeal everything. The privilege of being able to be a dental hygienist is in 2 minutes, I can look on your mouth and determine disease. I mean, that's pretty amazing, right? So we have new technology now where we can swab the 5 areas in your mouth. We can send it to the lab. The lab can send us back a report saying, hey, out of the 11 bacteria that cause gum disease, this person has 1, 2, all 11 bacteria, and show you the markers you test positive for: Alzheimer's, pancreatic cancer, colorectal cancer, heart attacks, strokes, all from that test. Why aren't more dentists doing this test? I mean, wouldn't you want to catch Alzheimer's early? But it's like people just don't put 2 and 2 together. And I'm really hoping that, if they can listen today, maybe a light bulb will go off. If they haven't been to the dentist, maybe they'll make that appointment. Go to my YouTube channel. I've got all kinds of videos on how to brush, how to floss. I have books written on the subject. So, hopefully people will start taking this more seriously, because dental decay is the #1 disease in the world.
And a couple things. First of all, I've never met anybody with furry teeth before.
It feels like fur to the tongue, when it's all
That's
rough.
what my mom says.
Yeah.
Mm-hmm.
She says that too. I have furry teeth. So
Yeah.
did you ever ask her if she
says
combs
that
her
they
teeth?
feel fuzzy.
Yeah.
And the other one is, no, you don't need a colonoscopy. Let's look at your teeth. What?
It's the fusonucleum bacteria, I believe it's called, is the one that's linked to colorectal cancer. So, and the thing is, I'm seeing this bacteria in some young people, which is really scary, because the incidence of colorectal cancer has dropped for people, in their 20s and 30s are now getting it. So we can screen the mouth and find out so much about your health, and people don't want to do it because insurance doesn't cover it. But we can't let insurance dictate our health. We have to really be our own advocates and determine what route we're going to go, instead of saying, well, insurance is only going to cover this. That's all I'm going to do. It's kind of foolish, actually.
Well, and insurance, quite frankly, doesn't cover a lot as
It's
far
really more of a discount plan. I mean, the benefits of insurance have not increased since the 1980s, but the cost of dentistry has gone up tremendously. So, you know, back in the 80s, you might have been able to get quite a bit of work done for $1,500 or $2,000. Nowadays, one crown is $2,000. So you're not going to get very far. That's why, you know, I try to tell people that neglect is expensive. People say, oh, I can't afford to go to the dentist. You can't afford not to go, because if you end up with a problem, that is going to be like, you know, a Mercedes Benz that you're dealing with instead of a $300 filling or maybe one crown. So neglect is really, really expensive.
And by the way, so everybody knows that we have this gentleman is becoming a friend, a really good friend of the show, and he's from Kenya. And I wonder, and he's following this discussion closely, because I'm willing to bet that the dental care in Kenya is not quite as good as it is here. I'm
sure.
Venture to guess that. But in any event, Heather, the I almost said Heather the hypnotherapist, but Heather the hygienist is with us, and we're going to talk when we come back from this break. We're going to talk to her in regards to the products and what she and the book she's written, and how you can help your teeth just by doing a few things, I think. And unless you're me, and then you wait for your teeth to fall out. But in any event, we will be right back. And Rochelle, do you want to be a real estate agent? You have been
an investor, but you know, that's along the lines. Yes.
Well, if you ever want to be a real estate agent, I encourage you to find this guy, because he's really good at what he does. We will be right back in right about a minute.
You became a real estate agent for freedom, success, and real momentum. So why are you still stuck waiting for closings to save you? I'm Ophir Adar, founder of Real Momentum, and I help agents like you become seven-figure earners. My first client that I coached, brand new agent, made $250,000 back in 2006. What's the secret? You feed your white wolf. That's the part of you that's bold and unstoppable and a closer and able to build rapport quickly. So click Get Listings at Real Momentum and let's unleash your real estate potential.
And welcome back to Positive Talk with Kevin McDonald and Rochelle. She's right there. That's her. Sometimes you don't see her, but she's always around. So we're so happy that she's here. And Heather, the hygienist, is with us, and she's been doing this a long time. We were joking before the show. She's got 23-year-old twins, and I asked her what it was like to have to be pregnant when you were 10, and she didn't think that was particularly funny, but. But she's a beautiful lady with a tremendous smile, just like Rochelle. And you really love what you do, and you love helping people learn how to, and I don't want to speak for you, but I'm assuming that you love what you do because you're sticking your hand in people's faces all the time, and you want to teach them the best way to clean up their mouth so that they can avoid some of the issues that, as an example, I've had.
Yes, absolutely. Well, there's really a few main things that people, when they come to me, they complain about, and that is sensitive teeth, cavities despite fluoride use, and bleeding gums. So I, being so passionate about natural things, I went to the health food store and I just started looking at ingredients, and I couldn't believe what some of the ingredients were inside even your natural oral care products. So I'm like, I really wanted to be able to feel comfortable recommending something to my patients that was clean and green, but safe and effective. And so I honestly started making mouthwash in my kitchen. And it's colloidal silver base. So colloidal silver doesn't disrupt the oral microbiome because, people don't realize how you get a cavity. They think it's just eating sugar or something like that. But if your saliva drops below a 5.5, that's how you can get decay. So your commercial products, like, your blue ones and all the name brands, their pH is like a 4.2. So you're swishing with acid and you're creating a bad environment. You're disrupting that oral microbiome. So instead of making it more healthy, you're making it worse. You're making the bad bugs multiply. Fluoride toothpaste also disrupts the oral microbiome. It can corrode implants. So if you have implants, you have to stay away from fluoride toothpaste or it can cause corrosion. And again, it's disrupting the oral microbiome. So, in 65 years, have we not come up with something better than fluoride? Of course we have. It's called nanohydroxyapatite, and actually NASA created it back in, I don't know, the early 70s, I think, because what they were noticing is when their astronauts would be in anti-gravity situations, they would lose bone mass. Their teeth would be affected. So your teeth are made out of 97% hydroxyapatite crystals. So when you use something bioidentical, your body receives it, right? And I know that there's been some concern about it crossing the blood-brain barrier, but that already happens in your teeth. You're already getting bits of hydroxyapatite crossing your blood-brain barrier because it's part of your teeth. So it's not going to harm you at all. It's something your body recognizes. It helps strengthen teeth. It's natural. If you pick up a tube of toothpaste that has fluoride in it, what does it say on the back? It has a poison label, right? Harmful if swallowed, contact poison control. That's because it's a halogen, it's a mutagen, it's a neurotoxin. I mean, most people are not aware that the EPA was actually sued, and the federal government ruled in a court of law last August 24th of 24 that fluoride is indeed a neurotoxin and does reduce the IQ. So I think people are wanting to have more natural alternatives, and I have an all-natural oral care line that supports the oral microbiome, is very pH balanced, and just helps restore things that get demineralized inside the mouth using natural ingredients. Because I think God gave us everything we needed in nature to heal ourselves, and we just need to really learn, what works, what doesn't work. But I really want people to kind of ditch the toxins and just start making one small change at a time.
Heather, and in the research that you've done, aren't there places on the planet where people have lived forever and they eat what they find locally there in plants and vegetables and animals and that kind of stuff, and they never have tooth decay, and they don't, and their teeth don't fall out of their head like mine did? Is that, I mean, that is a real thing, isn't it?
Yeah, Dr. Weston A. Price did a ton of research. He was the first one to discover focal infection, basically, and he did go to indigenous places that didn't have commercialized foods and ate natural. And what he discovered is everyone that was eating the natural, the high amounts of protein, the organ meats, and all of these other things had nice wide spaced jaws. They didn't have dental decay. They didn't have gum disease. So our diet, I think, really has impacted in a negative way tremendously. Plus, ever since the Industrial Revolution, women stopped really breastfeeding their children. So instead of the nice wide jaw, you have more of a narrow vertical growth. And with that vertical growth, you have a compromised airway. And so airway obstruction really is extremely underdiagnosed. I think 80% of people have undiagnosed sleep apnea. So if you're not getting oxygen at night, you have a serious problem. But unfortunately, in dentistry, they're not trained to really evaluate the airway. The myofunctional therapy really is what it's called. It's kind of a separate certification, which I am certified. And I have a whole chapter of this in my book, Dentistry Made Easy. because I wanted to teach, especially parents of young children, if your child is breathing through their mouth at night, that is a serious problem. They're going to probably end up with attention deficit disorder. This leads to anxiety, depression. It can eventually turn into heart problems. So everything really starts right here. We just need to start learning about the signs and what to look for, and really what you can do to prevent things from becoming a problem later on in life.
Rochelle, did you know any of this has even existed? I'm blown away here.
Yeah, and not only am I blown away, but I'm a little worried, I I know we need to take a quick break, but I will share with you openly. I hate the dentist. It is the worst living place on the planet of the earth. When I get up from my seat, you can see my whole body little sweat stain, and my mom will put it's the only place I'm like, really, I need my mom in this moment, and she'll put tissues in my hand that will end up soaking wet. And it's there's so many things that you just said that brought up so many subjects that people are like, what the heck did she just say? And what exactly does that mean? So Kevin, go ahead and take us into break, and then I have some questions about that.
Sure.
Well, we've got 5 minutes left, but one of the questions before we got to go to break, but one of the questions I wanted to ask you, you said something about something, and it sounded to me like it was like there's fecal matter, but it wasn't fecal matter.
Myofunctional therapy. It's basically physical therapy of the jaw, the tongue, and the face. Because everything, your tongue is the muscle, right? So like Rochelle, she had braces done, but so many times what happens is your teeth relapse. They start to shift back, and that is usually because of improper tongue posture. So the tongue should never be on the floor of the mouth. The tongue should actually be up on the roof of the mouth, but people don't realize this. So having that low tongue posture, whether it be just out of habit or sometimes it's called a posterior tongue tie, that tongue is too tight to the floor of the mouth, and that's where the therapy comes in. We try to do some exercises like physical therapy to stretch that ligament, see what we can do through exercises. Sometimes we need to have a tongue tie release, and we work with a specialist to release that tissue so that they can get their tongue to where it belongs. But if your airway is compromised, it's a serious issue. And so many of our young kids today are having ADD, right? But if you watch them breathing, what are they doing? They're breathing through their mouth. And so if you breathe through your mouth at night, that keeps you in a state of fight or flight. You can never get into parasympathetic, which is rest and digest. So if your body is constantly in a state of fight or flight, you're going to have a serious problem. You're going to have a sick child. You're going to have a child with some attention disorders and possible anxiety and depression. All of this goes together in IBS, like stomach issues, because your body just can't get into rest and digest. So it's a very underdiagnosed problem that we have in the US. And again, in my book, Dentistry Made Easy, I have an entire chapter on myofunctional therapy. So hopefully people will read up on it, maybe take their child in to be evaluated by a proper therapist, and start early, because if we can avoid these things when these kids are young, as they're developing, it's going to just save them thousands of dollars in orthodontic work later on. Because, maybe Rochelle, maybe your tongue was too tight to the floor of your mouth, and that was keeping everything constricted. So that would have been interesting to see some before pictures.
Well, and one thing I want to ask you about specifically is the whole, I have really bad asthma, and I've got allergies on top of it. So to me, the concept of having either my mouth or my nose covered at one point in time would make me freak out. And I wake up in the middle of the night and I have to hit my inhalers most nights as I've gotten older, even though I have medication I take for my breathing already. And it definitely, I wake up in this just like, oh my Lord state. And
you're probably over breathing, because what happens when you don't breathe through your nose is you have too much CO2 in your lungs. So you need to practice some exercises. There's a really great book I would suggest you get called Close Your Mouth by Patrick McEwen. And there's exercises in there for people that specifically have asthma, that he has gotten so many people off asthma medications from doing these exercises. So when you understand the breathing techniques, like a lot of it is the Butenko method of breathing, and go to an ENT, make sure there's no functional structural reason why you can't breathe through your nose. There's nasal hygiene things that you can do, whether it be saline rinses or boom boom sticks that have like real strong menthol in.
I've used those, and the Flonase. That's been a huge part of my life.
If your lips are open at night, your lungs are like a vacuum. They're going to suck air in, and your lungs are not designed to filter the air. So it takes like 65 days to filter the air that your nose does in 15 minutes. And then you don't get any nitric oxide. So you're over breathing. So we use mouth tape, we do exercises. But if someone just grabs some mouth tape and they've been a mouth breather their whole life, they're going to rip it off in 5 minutes because they're going to feel like they can't breathe. So this is where we have to evaluate them. We have to start slow. We have to do different exercises, sometimes get evaluated by a dentist that's trained by the Breathe Right Institute or the Tongue Tie Academy to see whether or not they might be a candidate to have a tongue tie release. So that's where all of that kind of comes into play. But if you are having asthma, I would definitely recommend that book, Close Your Mouth by Patrick McEwen, and start doing those exercises.
Okay. Yeah. When we come back, I want to also talk about if that can possibly affect your dreams by the way you're breathing.
Yeah.
Apparently that would be yes. And I'm sitting here and I'm tongue-tied. So we're going to take a break right now.
You're listening to Brushwood Media Network, the best in syndicated talk, news, and entertainment shows.
As you go about your daily life, look closer. As you gather with family and friends who love and support you, look closer. There are youth right in your community who don't have the home, warmth, and healing you have. So look closer. Every year across America, a staggering 4.2 million youth are homeless or trafficked. And for 50 years, Covenant House has worked relentlessly to keep them safe and protected. Tonight, 2,000 young people will sleep safely in a Covenant House bed. And tomorrow, they will wake up surrounded by love. They get clean clothes, hot meals, medical care, and a safe place to sleep. 24 hours a day, 7 days a week. In sites across America to help them fulfill the great promise of their lives. So look closer at Covenant House. To help or get help, go to covenanthouse.org.
And welcome back to Positive Talk with Rochelle here, who is learning more about, it's too late for me, but Rochelle's learning more about dental hygienist, and Heather the hygienist is here. And you know, she asked a very interesting question that I'd love for you to follow up on, and that is that she's told me since I first met her that she's got these amazing and not so amazing dreams that she has at night. Continue with that, Rochelle.
Yeah, it's just it's more than a nightmare. It's like terror. I would almost think of it as like my soul leaves my body, goes to other dimensions, does other things, experiences these extremely traumatic events, animals that don't exist, things that would never actually happen, but it's very much always in confusion and survival mode. And then when I wake up, on top of that, I'm barely breathing. And it's just really hard to struggle with sleep. And I think a lot of people do more than we know.
Well, a lot of women, especially thin young women, may not necessarily be having apnea issues, but could have what's called UARS, which is upper airway resistance syndrome. I would definitely recommend you get a polysomnogram test. It's a sleep study, specifically polysomnogram, and it's something that you can do at home. And what it'll do is it'll show, like, you know, what your sleep pattern is. But it sounds to me like you definitely have either it's apnea or UARS that is totally affecting your sleep. Because again, you're in fight or flight. Sounds like you're not getting into parasympathetic at all.
Doesn't feel like it. And I wake up so tired, Heather. I feel exhausted some days. It's just like I didn't rest and I didn't sleep. And I realize how it can affect me even throughout this time. And I've tried everything. That's why talking to you just feels like this huge thing, because I've tried all the external methods or like the meditation. But this is a whole different category and nothing I really would have thought of, I don't think.
Well, when we get off air, I want to take a quick look at your tongue.
Okay.
When you're done. Yeah.
Okay.
You're out here.
How rude. I've never even asked to look at her tongue.
But I think you would definitely benefit from a polysomnogram test. I highly recommend you get that. A lot of your medical insurances do cover for sleep studies. So I would definitely suggest you take advantage of that. And when it comes to dental anxiety, in my book, Dentistry Made Easy, I have a whole thing in there about things that you can do. It sounds like you have your mom with you, which is good, but there's nitrous oxide, which is an anti-anxiety gas that you can be breathing. Having an advocate, listening to your favorite music with headphones, certain essential oils. Some of my patients have like things where they want me to talk the entire time. That makes them feel better. Others don't want me to say a word. So whatever things that make you feel comfortable, we can do. There's sedation dentistry where we can totally knock you out. But, I think if you can establish a relationship, it becomes so much easier, time and time again. I've worked with many dental folks over the years, and they have gotten to the point where they're no longer needing even nitrous oxide to have me treat them because they're comfortable. They know what I'm going to do. They know what to expect. And because they've come such a long way with their gums, they're in good health. So it's not bad.
Right.
It's I've not been to the dentist in 5 years. I'm freaking out because I have no idea. Do I have disease? Do I have cavities? And then getting that treatment plan and you don't know what to do from there, because I always tell people your teeth poop. All right. Brushing only off 60% of the poop, right? So the rest is in the toilet bowl, and that is the space between your tooth and your gum. So floss the teeth you want to keep. And I don't mean the cheaters. You have to use manual floss. So you got to brush twice a day. You got to floss the teeth that you want to keep, and you've got to get your teeth cleaned. If you're somebody that has gum disease, you need your teeth cleaned 4 times a year. If you're somebody that's more cavity prone, you can get away with twice a year getting your teeth cleaned, but you have to stay on top of it.
I've never heard a dental hygienist say, "Did you know your teeth poop?" What? What are you talking about?
Or your teeth are giving you anxiety because they're making you breathe different. Like what?
Oh, I wanted to ask you, Heather, because I was diagnosed with mild sleep apnea.
Mm-hmm.
And because I live alone, so I sleep alone most of the time. No, Anyway, I sleep alone, and so if I snore a little bit, it doesn't matter to me, and I sleep. But I have this sleep apnea machine. Mm-hmm. Will that help her? If could she benefit by using that machine, or is it a different machine that she would need to use?
So if her polysomnogram comes back where she's having upper airway resistance syndrome, she definitely needs to have myofunctional therapy, and we need to have her evaluated by someone, like I said, trained either at the Breathe Right Institute or Dr. Baxter's Tongue Tie Academy to see if she is a candidate for tongue tie release. Because if you don't address the root problem, like it's just not going to get better. There are appliances that can move the lower jaw forward to open up the airway, but that is a temporary fix. We need to fix the tongue. We need to get that tongue into a better position. We need to address that root cause, or, who wants to be on a CPAP machine? It's not fun. They're not fun to travel with. It can, be rather cumbersome, affect her sleep. So if we can get her to where she is sleeping in REM and not having any resistance while she's sleeping, she's going to wake up and feel rested. She's going to not be so tired and have issues and also clenching and grinding. Do you clench or grind your teeth? Because that's usually a sign of your airway is restricted. So people
sometimes,
yeah.
Since I was really little, though, I would bite the inside of my lips to be like raw. And it was something that I would do when I would focus, when I was calm, when I was hyper, when I was angry. Like it was all the time. And my own state of mind, I think, has helped that a lot. But still, I have to catch myself. And I also, it brings this thought into my head about snoring. I don't snore, but every other person usually that I've known that I've ever been around to sleep snores. And they don't seem to ever have any dreams. Does that have anything to do with it as well?
Well, I mean, it certainly can, because if you're not getting oxygen and if you're staying in fight or flight, it's certainly going to affect you. And it affects different people differently. Not everybody has the same signs or symptoms, but I would definitely start with a sleep study test for you and see what you come back with, and kind of
Okay.
use that as your baseline.
And by the way, just so you know, Rochelle, you don't know that you don't snore because you never know when you're snoring, when you're asleep.
Well, I've heard that I grumble and I do talk. And apparently I move around positions lately a lot in my sleep. I'll wake up in a different spot than I went to sleep. That makes no sense, but we all have our things.
Yes, we do. By the way, we're talking with Heather, and she's a dental hygienist, and she's also written books. She's got a bunch of products. I want you to go to simplysilvermouthwash.com, and you will find all of the things that she did, all of the products that she has there, and also some of the books, because they did not tell me, and I'm just sitting here blown away. I got to tell you, because nobody has ever said how complicated, how interconnected the teeth are to every other organ of your body, which it makes sense now, because I've been told, like, as an example, if you have heart disease, that you put the cycloglycerin or whatever it is underneath your tongue.
Nitroglycerin.
Nitroglycerin, yeah, and underneath your tongue, you don't swallow it, because it will be absorbed into your body from your tongue.
Yeah, because underneath your tongue is the most vascular part of your whole body. So it bypasses your GI tract and goes right to your heart. So what do you think all that bacteria does? It clogs your arteries. So, and again, think of how close all that bacteria is to the brain. That's why when we do these screenings with the saliva and we're checking for areas in the mouth, and that test comes back, there's 2 bacteria specifically, and I can't even say them. One's AA and one is PG. That PG bacteria is linked to Alzheimer's. So think if you have this infection, this bacterial infection, you think it just stays here? It gets into your bloodstream. It gets everywhere. So, it affects the brain, and that's why they've directly linked this PG bacteria to both Alzheimer's and pancreatic cancer. So that's why I said there's things that we can do preventatively to find out, hey, does this person present this way? Take that test to your primary care doctor. Work with somebody who is going to take you seriously and not just brush it off, because I really feel like dentistry is 40 years behind the times when it comes to holistic health. I always encourage people go to a holistic dentist, because they don't look at the mouth as just a compartment like mainstream dentistry does. Standard operating procedures, always a root canal. It's always fluoride. It's things that really, when you start digging into the research, into the science, you need to start questioning. We need to have a better way of doing things, and start changing and looking up the science, saying 100% of root canal teeth have endotoxins. Fluoride does reduce the IQ and is a neurotoxin. Why are we still using it? It calcifies the pineal gland, which is also a major problem, because that's how you hear from God. So, I think that's why I want people to just start making one small change at a time. Ditch your commercial toothpaste, try something natural. It is going to be a little bit of a learning curve, because you don't need the foam. You don't need foam to clean. The foam is like in shampoo. It's sodium lauryl sulfate, and a lot of people end up getting kinkosaurs because they're allergic to it and they don't even know it. So you want to avoid chemicals. And let me just tell you, the reason that they can put toxic chemicals inside of your oral care products is because it falls into the category of cosmetics. That is why. So when you start reading the labels, become an avid label reader, and start looking at it. What the heck is Proxima 407? That's an endocrine disruptor. Okay. Sodium saccharin, known carcinogen. You've got so many chemicals inside of your oral care products, but because they fall into the category of cosmetics, they're okay. But you really just need to be your own advocate. So that's why I've written books. My book, Dentistry Made Easy, The Consumer's Guide to Oral Health and Smart Choices. It's like a handbook. Everyone should have it. And then I just wrote a new book called The Great Tooth Deception. revealing the dark side of dentistry, where I get into drilling for dollars and the whole history behind fluoride and mercury and root canals. So hopefully people will, start reading, become informed, make better decisions.
I got to ask you about fluoride. there's, as you know, there's a great big hullabaloo going on. Is fluoride good for you, bad for you, or if you don't have very much of it, is it okay? Or if you have too much of it, it's not okay. I understood, or I think I understood, that the history of fluoride was it was a scraping from, and was actually a byproduct of industry.
Yes.
That they were trying to figure out a way to eliminate it or to use it. And somebody came up with the idea of, well, if we put a little bit into our water, we could get rid of it. And is that a wives' tale, or is that a real story?
No, it's actually true. And his name was Edward Bernays. He was a public genius when it came to marketing fluoride, because the Alcoa, which is like the aluminum and phosphate companies, joined together to see about what can we do here, because they were having to basically, if it's not dumped into your water, it has to be labeled as hazardous waste. So, that was very expensive for the companies, and they wanted a way to repurpose it. So they rebranded their hazardous waste as, it's good for you. And technically what fluoride does is it creates like a form of hydroxyapatite called fluorapatite, but it's more brittle, right? It makes your teeth brittle. You can get fluorosis, and your teeth are the windows to your bones. So we have 1 in 5 children today with fluorosis. So it's toxic. It's a drug. It's unnecessary. Fluoride is not an essential nutrient. No one on the planet has a disease from lack of fluoride, because your body doesn't need it. It's unnecessary. So it's a drug. It's in Prozac. It's in many, many drugs because of what it does to the brain. So I don't want to be drugged. It's an unnecessary thing. I would like the right to choose what I put in my body. I don't like to eat chemicals. I don't drink them. And I certainly don't want to have to worry about, what's in tap water or certain medications. But fluoride is everywhere. It's in certain antibiotics that cause your tendons to tear off. And it's a nerve gas. I mean, it's halogen is fluorine is a nerve gas. So we don't need to drug people. People should be able to make a choice of what goes into their body. And we need to start using nanohydroxyapatite. It's bio-identical to your own body. So why are we not using this product? Because it's not follow the money. That's why.
When we come back from this break, I want to ask you about the alternatives to fluoride, because it's a really big deal. You've got politicians that are saying, well, if you take fluoride out of the water, all the kids' teeth are going to fall out and stuff, which I tend to believe is industry talking, not medical science talking. Right. And so when we come back, and by the way, if I'm going to have drugs, I want to know about them, and I want to be a willing participant in them, if you know what I mean. If I'm going to do something like that, not to have drugs that I don't even know that are out there. And by the way, you can do this. Very few people do, and very few people have, I'm sure. You can call your local water agency, and they are required to have a breakdown of what's in their water. So you can look to see what if they've got fluoride, what percentage, and all that kind of good stuff. So we need to take a real quick. I'm correct in that, am I not?
Yes. Usually it's fluorosilicic acid, but yes, you are correct.
Okay. I had no idea. So we'll be right back in it's just 30 seconds. We've got a lot more to share with Heather, and Rochelle lost something, and so she's gone for the moment. She'll be back, I hope. Then we'll be right back.
When the game is on the line, championship teams know the game plan. They communicate and work together to win. We all need a game plan to protect ourselves online. Talk to family and friends so they know how to stay safe too. Create strong passwords, turn on multi-factor authentication, update software, and recognize and report phishing, because online safety is not something you want to fumble. Get more game-winning tips at CISA.gov/secure our world. Then share them with family and friends.
And welcome back to Positive Talk with, well, somebody. I'm here, and we're hopeful Rochelle makes it back. That's I have to tell you, Heather, that's the one thing I don't like about our modern technology is that if you lose it, it's all gone, and there's nothing you can do. But in any event, and I just got a comment from somebody. I have to use my left hand here, so bear with me because my right hand doesn't work right now. And Gowdy says that Utah just became the first state to take out fluoride of our top water, or of our tap water, excuse me.
Florida did too.
Oh, Florida has as well, which is one of the few things. Well, never mind. That's a political thing. And but congratulations on the work that you're doing, and that you are helping people to understand just how complicated this all stuff is. Because when I was getting my root canals, and I probably had a dozen root canals or more. I had originally I had all my front teeth capped and all of that, and thousands and thousands of dollars. But nobody ever told me that there was a long-term issue with infections that went deep into my teeth, and that ultimately, even though the infections were not necessarily growing, they were infecting and me throughout my entire body. Is that correct?
Yes, but it goes against your mainstream practice. I mean, there's an entire multi-billion-dollar-a-year field that's called endodontics. So if you think that that's going to go away anytime soon, you're sadly mistaken. So that's why, I try and just educate people, and it makes sense. I mean, everything in the body is connected. So why is it that we're not taking this more seriously? And we don't know what one person's body can take versus someone else. I mean, your immune system can only handle so much, right? So for somebody that maybe is already dealing with a compromised immune system, that root canal might just put them over the edge, and they don't realize the direct link. So that's why there is a meridian chart that you can even go online and check, hey, do I have a gut issue? What tooth is that linked to? A lot of times too, people have wisdom teeth removed, but 30 some odd years later, that can, if it's not removed properly, it causes a cavitation site and is linked to heart attacks. So, but there's no direct cause and relationship here, because it takes so long to realize there's a problem. But I really want people to start looking at their mouth as maybe this is my problem, instead of just, trying to see what else it is. Start here first, because this is really so important.
Well, and when we're talking about our mouth, it's a pretty important organ and series of things that put it together. Because if you can't eat and you can't drink, and then you're going to die. So, and you can't breathe through it, so I love the work that you're doing. Explain again, because if you go to her website, which is Simply Silver Mouthwash.com, you can find all kinds of different products that she's got. What is your favorite product that you've produced? What is the one that if anybody buys anything at all from you or from this website, which product would you recommend the most?
I would say this spearmint mouthwash, because it's mild. It has hydroxyapatite in there, xylitol, baking soda, trace minerals. So it's great really for everybody, especially for people that are cavity prone. The people that have more of gum disease issues, the mint and the cinnamon is specifically made for that in mind, because it has myrrh, tea tree, clove, black walnut hull, and something called raw croton lechleri sap. And I know that that's a weird word, but it's also known as dragon's blood. That's what gives the color, like a brownish color, but it's so medicinal. So it's from Peru in the rainforest. The sap of this tree is like a liquid Band-Aid. So if you were to cut yourself, Kevin, and put the sap on that wound, it's a natural coagulant. So I have the sap in there. I have CoQ10, which, by the way, science shows that if you're somebody that has gum disease, you're lacking CoQ10 in your body. So it's extremely medicinal. A little bit goes a long way, but I would say that my spearmint is definitely my best seller, because it's kid friendly, even it's mild. The mint and the cinnamon are very strong. So if you like if you like a Listerine where like, wow, I really feel that, you would want the mint or the cinnamon. If you're somebody that is like, no, I just want something kind of mild, and I would go with the spearmint mouthwash. But all of my toothpaste has nanohydroxyapatite in there, and I'm the only toothpaste on the market that also doubles as an oil pull. So you can use it as an oil pull. The main ingredient is coconut oil. I'm the only one that also lists my RDA value. And I know that that's a weird word. People have probably never heard that before, but it's how abrasive your toothpaste is. So if your toothpaste is over a 70, that's kind of considered abrasive. Mine is a 31 or a 32. You only have one coating of enamel, Kevin. You don't regrow enamel. You can remineralize enamel, but it doesn't regrow. So once it's gone, it's gone. So you want to protect it. Some of your toothpaste out there that has bentonite clay and activated charcoal, it can be like over 150. So it's like using liquid sandpaper on your teeth. That's going to make your teeth sensitive. It's going to make your teeth actually more yellow. So you don't want to just use liquid sandpaper. You want to use something very safe for your enamel that's going to help remove stains and not be harmful.
And the other thing that just occurs to me, if your dental products are considered cosmetic, then the FDA does not, and well, first of all, the FDA doesn't do any testing anyway. And they rely upon the company that is bringing the product to provide details and the testing for it. So if it's a cosmetic rather than a food stuff or something because you're putting it in your mouth and stuff, I would think it would be much higher regulated than it seems to be. Am I wrong in that?
If you're making claims, then it needs to have testing behind it. So you would have to have like your American Medical Association or something through the FDA approved, because you can't just make a claim. So I don't make claims. I don't say, if you use my product, you're going to be disease free. That's making a claim. I can say my mouthwash will give you fresh breath. It'll raise the pH of your mouth, that kind of thing. But anytime you make claims, that's when the FDA or the American Dental Association gets involved.
And gotcha. And I've been single so long, I haven't had anybody tell me I have bad breath, but that's because I've had nobody that's close enough to smell my breath, I guess.
So here's a way to check your breath. You want to get as much of your tongue on your back of your hand, like that. Give it a second, and then take a whiff. So if it's not smelling like, nice mint, fresh breath, and it smells like poop, you got a problem.
Goody. I think I'm not going to do that. I tell you, Rochelle, welcome back. Do you have? And
Thank you.
We're running out of time, but do you have any other questions or any thoughts that you'd like to add?
Well, one thing you mentioned at the beginning of the show, which I just kind of want to bring awareness to, if you happen to know, is you said that it's successful to most people or doctors who do the procedure to have a root canal last 8 years. So by saying that, does that mean that once you have one, you kind of always have to continuously get it done, or work that needs to be upkept, an extra cost that will forever go into playing that out if it doesn't last, or if it does?
Usually it ends up getting pulled and you need an implant. That's usually what ends up happening, because it's dead in a brittle tooth. So a lot of times it gets reinfected. They try and retreat it, but it makes it so weak and brittle. It usually ends up getting cracked, and they have to pull it and put an implant in anyways. I do not personally recommend titanium because they're finding it does cross the blood-brain barrier, and a lot of women actually have a nickel allergy, which nickel is in titanium as well. So I like zirconium. It's more bioidentical to your body. It's safer. So I do like zirconia implants, but most of the time they end up having to get pulled, and then you need to have an implant anyways.
Okay.
Interesting.
Yeah.
And by the way, Heather, give us your information one more time. We've run out of time. You're going to have to come back, because you said a bunch of words that I have no idea what they mean. We're going to have to identify what they are.
I'm happy to come back. It's simplysilvermouthwash.com is my website, and you can always reach out to me through the email, which you can find there, or it's Heather@simplysilvermouthwash.com. So if anyone has any questions, I have consultations. We can always touch base.
And we got to go now, but then Heather's going to look at Rochelle's tongue. I don't know what that's going to look like. I'll try and save the video of that. That could be interesting. So anyway, I want to thank you, Heather, for being here. Go again to our website, which again is
simplysilvermouthwash.com.
And Rochelle, thank you for coming back. And and we've got another show coming up in a half hour, and we'll hopefully see you then.
Yes,
Thanks for listening to this episode of Positive Talk with Kevin McDonald. Our purpose is to provide everyone with a positive, entertaining, and educational experience. I would love your feedback and comments about the show, including possible topics and great guest suggestions. Please email me at kevin@kmmedia.pro. And remember, be kind to one another because each other's all we've got. That's Kevin@kmmedia.pro.
All right. So what